Hypothermia is commonly known as heat stroke. Mild heat stroke is often referred to as heat stress. We spoke about pyrexia in Chapter 2. That term is used to describe a fever, usually caused by an infection or perhaps inflammatory pain. But heat stroke or heat stress is due to external factors, being exercised in hot weather, left in a car when it's too warm outside, or left somewhere where the temperature can get really high, such as a conservatory. Some dogs are at an increased risk, more so than others, including those with underlying health problems. So first up, who is at an increased risk? Obese dogs, especially those who are particularly unfit. Elderly dogs are also at risk, as they are less efficient at cooling themselves and so fall into that high-risk category. The large and giant breeds are also at risk of overheating, more so than the miniature and toy breeds. Again, risk will be further increased if they are elderly and or overweight. Our Brachiocephalic breeds, those with a short muzzle or flatter face, are at least twice the risk compared with breeds who have medium muzzles known as mesocephalic or longer muzzles known as dolichocephalic. This is because they have a narrower and shorter airway, providing less space for the cooling of warm air. Also, air is drawn over the surface area of the tongue to cool when panting. Longer-nosed dogs have a larger, more effective surface area to do this than our brachy dogs. If your brachiocephalic dog is known to have BOAs, so that's Brachiocephalic Obstructive Airway Syndrome, then you need to be very careful with these dogs, even in the high teens, like 17, 18 degrees. Can be a lot for these guys. And the others that are at high risk are those with any other breathing difficulties or perhaps heart problems. So conditions such as tracheal collapse, usually seen in our smaller breeds where the trachea doesn't open as well as it should, or laryngeal paralysis, normally in our larger breeds, and that's where part of the larynx basically flips across and obstructs the airway for a period of time. But any of these conditions that may be going on could put your dog at high risk of developing heat stroke, even as we're in the high teens, reaching 20 degrees. There are also certain breeds said to be at a higher risk of heat-related illness, and their risk has been compared to a Labrador's risk. Pugs, Golden Retrievers, English Springer Spaniel, and Cavalier King Charles Spaniel are all at 3 times the risk of developing heat stroke compared with a Labrador. Greyhounds at 4 times the risk, Dog de Bordeaux 5 times the risk, French Bulldogs 6 times the risk, Bulldogs 14 times the risk, and Chow Chows 17 times the risk of developing heat-related illness when compared to a Labrador. So what are considered to be dangerous temperatures? Firstly, I am referring to temperatures usually seen in the UK and Ireland, because we usually have very few hot summer days, nothing really consistent compared to other countries where they may have more consistent hot weather, giving the dog the chance to acclimatise. It usually does take around 6 weeks for a dog to acclimatise to hot weather. So I've spoken about the old and obese and those with health problems, etc. They will still be at risk whether they acclimatise or not. It is important to say that knowing the signs of heat stress and heat stroke are vital, as your dog may not cope at the temperature you would expect them to, and may indeed need to be protected at much lower temperatures. In general, 15 degrees centigrade is safe for the majority of dogs, but a few may still struggle, so watch for the signs. Again, up to around 19 degrees centigrade, many will cope just fine, but be careful with the high-risk breeds as temperatures start to reach the higher teens, especially as temperatures dip into the early 20s. It is at this point that those obese, elderly, large breed, those suffering with underlying health conditions and specific breeds become at danger level. Most dogs will find temperatures in the mid-20s uncomfortable, but those who are fit and healthy will cope better until we reach 28 degrees centigrade and above, at which point it can become life-threatening. And if it's 32 degrees centigrade plus outside, then it's dangerous for all dogs. So what are the signs and symptoms you are looking for? Signs of heat stroke can vary depending on the severity. In the early stages, symptoms can be classed as mild, heavy breathing and panting, lethargic and unwilling to exercise, increased pulse rate, and a darker, redder look to the mouth in general, but especially the gums and tongue. As it progresses, dogs start to excessively salivate and have diarrhea, vomiting, or both. They can suffer tremors and stagger when walking. This is also known as ataxia, and this can lead to full-blown seizures and collapse. Seizures will increase body temperature further, leading to severe signs where the dog can pass blood in both the vomit and diarrhea, become unconscious, and have bleeding or hemorrhaging under the skin. At this point, they will be in multi-organ failure, including brain damage, that can all become irreversible if not treated quickly, although even with treatment, many at this stage sadly do not make it. You may see bruise-like red dots under the skin, on the gums, and inside the ears. This is due to hemorrhage, which can be seen in our severely affected heat stroke dogs. Petechiae hemorrhaging can also be seen in a variety of other diseases, and if noticed on any dog, they need immediate veterinary attention. They can also be seen with certain toxins like rat poison, so retrace your steps on a walk or look for potential toxic substances your dog may have come into contact with, but do this after they have arrived at the vets and are receiving treatment. Did you know that one of the very early signs that your dog may not be coping with the heat is if their tongue looks swollen or larger than normal? It may be hard to tell, so certainly look for other signs like a fast pulse and red gums and tongue. Just be very on the ball. Even if your dog is just out in the garden, they may be tempted to sunbathe and begin to overheat. Early intervention is important. So how else can you prevent heat stroke? Prevention is firstly not putting your dog in a compromising position to begin with. Walking at cooler times of the day, usually very early morning or late in the evening, or missing a walk if it's a hot day. Never leave them in a car. The temperature can go up by 10 degrees centigrade within 10 minutes. If you are travelling in a car, make sure the area where your dog is located is also cool and has good airflow with air conditioning. And remember, rooms like conservatories get extremely hot, so not leaving your dog in such places. Offer lots of hydration by having multiple water bowls available and reminding your dog to take a drink, although generally they have a good thirst drive. You can add ice to the water. You can also offer iced treats for them to eat, like frozen blueberries. Blueberries are a superfood for dogs, so they are actually a great thing to feed. Obviously, make sure whatever you offer is a safe food. We just don't use ice to help a dog who is suffering with heat stress or heat stroke, but they can have it when well. Remember, ice is hard, so could damage teeth, just another thing to be wary of. You can provide a paddling pool for them to cool off in, but prevent sunbathing after they've got wet. You can also spray the feet and belly with cool water regularly. Studies show that water of around 15 degrees centigrade appears to be an ideal temperature to cool with. Water out of the cold tap in the UK is said to be around 13 degrees centigrade. Cooling mats and cooling coats are both available. Firstly, watch that the mats are 100% non-toxic, because some dogs may chew the mat and you need to make sure it's safe. There are many cooling coats on the market. How effective they are is really dependent on the type and the way they are used, so do your research. Although a little spray and cool down with the hose isn't necessarily a bad thing, encouraging dogs to play with water in this way can lead to over-ingestion and hyponatremia, which is water poisoning. And this is covered in more detail in another chapter. So how are we going to treat heat stroke or hypothermia? Well, there's a few things to consider. Firstly, we've got to think about how heat leaves the body. So if this was our dog's body, heat is going to leave and evaporate away in this direction. So if we placed a cold, wet towel over them, all that's going to do is act to heat the towel up and consequently then heat the dog up. So placing something over the body is rarely a good idea. A fan of some kind blowing on the dog and taking hot air away is a good idea. Using water, so using cold water. Now, the optimum temperature is said to be between 15 and 16 degrees centigrade. Now, tap water, I believe, so from the cold tap in your home, is around 13 degrees centigrade. So it's not far off that. So that feels quite cold. So that would be sort of an acceptable level. What I do find quite useful as well for some of these dogs is to put a bit of honey or jam on their gums or inside their mouth, because with heat stroke or with a dog that's getting very, very hot, we do often find they can become hypoglycemic, so their blood sugar starts to drop and then they're at risk of having a seizure, which will then create more heat and perpetuates the whole problem. So I find that that is quite a useful thing to do. When we're using our cold water, we're using it on things like the paw pads, the legs, the abdomen, the ears and the head, all the places where they're sort of sparsely, with the hair is sparse. We're also thinking about, when I spoke in the first chapter, I said about never raising the hind legs of a dog that you know has been in a traumatic incident. Now, the only time I'd consider raising the hind legs is for our heat stroke dogs. That's because it will increase more blood flow to the brain. As long as you know they haven't suffered any traumatic incident and you don't believe that they're bleeding internally, that's an acceptable thing to do. And what I usually do is use a cold, wet towel under those legs to raise them up. And you will want to replenish that towel around about every 15 minutes because that too is going to trap heat. Heat's moving away from the dog. So we definitely want to think about that. Now, I know that this is probably more for information purposes because you're not going to solely treat heat stroke at home. You need a vet. They need to see a vet. But the rule of thumb is, in general, that when our dogs get to around 39.4 degrees centigrade, we tend to stop the cooling process at that point and allow the dog's body to take over and do the rest of the work to prevent us, going over the top and cooling them too much. There are some people out there that think that rapid cooling techniques, so using, very cold water, almost ice water, is a good way of cooling our dogs down. I like to take it easy. I think that the risk there is that when a dog is hot, they've vasodilated, the vessels are open. When we pour extremely freezing water on them, we will get vasoconstriction. So that's where the veins and arteries will shrink. And the problem with vasoconstriction and that happening is that we could then, if we have a dog with, say, a heart disease or something like that, we might end up pushing them into something like a heart attack. So I think all the tips that I'm giving you are good enough for you to be getting on with at home. If your vet does advise that you up the process and make things even more extreme, like using something even colder, then that's a different scenario. But for you, this should buy you all the time you need for your dog to be able to get good treatment at your vet's. This may help our brachiocephalic dogs especially. A cool pack under the throat area, just be sure to wrap it in a tea towel first. Using cold wet towels on a dog isn't the best idea, as you are putting a layer over them that may prove to act as insulation rather than cooling. So I'd really advise that you don't do that, as heat is lost by evaporation and the towels will trap it in. But you could lie them on a cold wet towel, but you definitely want to regularly change this towel as heat will be absorbed from the body into the towel. So you want to make sure it's remaining cold and wet. And you can use one to raise their hind legs during travel. Remember, this is the only time I would advise you to raise the hind legs. As for wetting the entire coat, often it can be an argued topic, with some saying if you soak them, their temperature may well drop down too low. You have no control, unlike cold packs that you can remove, or small patches of wet fur on the belly and ears. Others will say wetting the coat will help. To be honest, if they have a thick double coat, it may not be that helpful, as it's difficult to soak right down to the skin. Be guided by your vet and the symptoms you are seeing. For the very hot, extreme cases, wetting the coat certainly will be done, and also applying a fan to these dogs. We need circulating air along with a wet coat. But for others, it could be time wasting at the very least. Remember, keep the water around 15 degrees as it seems to be an ideal temperature if you do wet them. Ice is fine to give to dogs to keep them cool. The main risk really is breaking a tooth if they crunch it, but it's a fairly low risk. But for a dog displaying signs of heat stroke, it can have an adverse effect. It causes blood vessels to constrict and encourages the dog's core body temperature to remain high. It can then lead to hypothermia. Plus, for some dogs, especially with heart conditions, it could cause cardiogenic shock, so a heart attack, but there isn't strong evidence to support this. It is best to use water at the correct temperatures. In some cases, you may be advised to use something colder, but this will be at your vet's discretion based on the clinical state of the dog at the time. One last but very important point is if you do decide to soak the body and are advised to do so, you must keep the nose and mouth free of water. I remember a case of a dog who was showered to cool down but was unable to stand, so was lying down in the bath. Sadly, he inhaled a lot of water as he wasn't in a conscious state and consequently died of drowning. So please keep this in mind. Also ensure the water isn't freezing cold.